Okay. I'm admitting there are two in the waiting room. Great. John and Stacy.
Good morning to everyone who's joining us online. We're going to go ahead and get started in a moment here. Thank you for being here. We do have a PowerPoint for those online that we'll be sharing with you as well when our guest speakers are speaking. All right, so I think we're going to go ahead and get started. Good morning, everyone. My name is Rachel, and I am one of the co-chairs of BPTO. Before we do anything else this morning, we'd like to begin today's meeting with a land and people acknowledgement. We'd like to start by acknowledging the traditional territory of the Haudenosaunee and by honoring the sovereignty of the Six Nations, the Mohawk, Cayuga, Onondaga, Oneida, Seneca, and Tuscarora, and their land on which we are situated and where our coming together today, virtual and in person, is rooted. In this acknowledgement, we hope to demonstrate respect for the treaties that were made on these territories and remorse for the harms and mistakes of the far and recent past, as well as ongoing harms. We would like to acknowledge the stolen labor and lost lives of enslaved African people, the generational struggles for freedom, civil rights, and racial justice led by Black people in Buffalo and the wider region, and the persistence and destructive force of white supremacy within and across our economic, political, and cultural institutions. We pledge to center the leadership and lived experiences of Black, Indigenous, people of color communities to work in mutuality and solidarity with a spirit of reconciliation, restoration, and reparation, and to dismantle systems of oppression and legacies of settler colonialism and white supremacy that continue to diminish, degrade, marginalize, and exclude Black, Indigenous, people of color communities across our region. So what we'd like to do very briefly is to review our expectations for today's meeting. We are so glad that you are all here. We want to hear from everyone who's here, and in order to do that well, we would ask you to follow our meeting protocols and expectations. If you do have a comment or a question to make, please wait until the time when the speaker or person who is running that portion of the meeting is ready to take your questions. We also ask that you limit your comments to 2 minutes so that we all have a chance to get involved in a healthy discussion and dialogue this morning. We also do have some food and beverages available. We would ask that you keep your mask on unless you are eating or drinking. That is, of course, for all of our collective safety. Wearing your mask is also about protecting others in this room, and we want to make sure that we uphold and encourage that spirit of collective responsibility and community. So thank you for all of that. As I said, my name is Rachel. What I'd like to do is just go around the room in person here this morning. If you could just say your name and the organization that you're affiliated with, if you have one, and your role, and if you have kids in the Buffalo Public Schools, we'd love to hear about that. So I'm Rachel. I have a son who is an 8th grader at School 195 City Honors, and I myself am a proud graduate of Buffalo Public Schools. I'll pass it here.
Thank you. Good morning. My name is Laura Samolsky-Peters. I am the Assistant Superintendent in the Office of Shared Accountability for the Buffalo Schools. And my son does not attend Buffalo Schools, but I have worked here for way more years than I want to acknowledge. And I feel like the children that I've worked with in all this time have been kind of like my children too, you know? So I feel that, yeah, that's all really what I have to say about it.
Good morning, everyone. I'm Sharon Brown, the Assistant Superintendent of Student Support Services. I'm very happy to be here today. And so our division, we have several offices that support students directly. Don't have any children in the Buffalo Public School District. I have bonus children, but As
Yeah.
Laura just
Bonus
said,
children,
they're like,
love it.
we have several children that we embrace. So
Yeah.
thanks again for having us.
Good morning, everyone. I'm Selena Smaller from CS Buffalo. I'm representing Betsy and of course the whole organization. I have a daughter not in Buffalo Public Schools, but I'm also a graduate of Buffalo Public Schools. My school's no longer in the district, Buffalo Traditional, but all my teachers and administrators I've been able to work with over the past 12 years since I've been doing this work. So thank you.
Hi, good morning, everyone. My name is Brittany McKay. I am the Community Recruitment Specialist at Girl Scouts of Western New York. I do not have any children in the Buffalo Public School system, but I am also a graduate of Buffalo Public Schools, so I'm just happy to be here and meet everyone.
I should say graduate count.
Oh,
right?
You want to go back there to you?
Good morning, everyone. Ramona Reynolds, and I oversee the Buffalo Schools Family and Community Engagement efforts. I'm a graduate of the Buffalo Public School System. I have a niece and nephew, one at middle early college, one at performing arts, and am the, I'm gonna say, parent, aunt, mentor to almost 34,000 students.
Hey, that's it.
So I'm happy to be here.
My name is Davon McCune. Kids call me Mr. M. Work for Push Buffalo. I run the Grant Street Neighborhood Center. Graduated from City Honors. I have no biological kids yet, but I've been working in after-school programming for over 10 years. So I have hundreds of kids that some in BPS and some in college.
I love the spirit. That's it. Yeah.
I'm Chris Salamone. I'm the treasurer of the BPTO. I retired from the Buffalo Public Schools as a teacher June. I'm a graduate of Buffalo Public Schools. My 3 kids graduated from Buffalo Public Schools, and now I'm subbing. Every day.
Tuck back in.
Yeah, I'm ending.
So
My
you're
God.
retired.
Yeah.
My name is Kate Hawk, and I am the curriculum chair for Buffalo Parent Teacher Organization. I have been the secretary in the past, a long time member, but I moved to Philly for a little bit, but now I'm back. And I have 3 sons who all graduated from Buffalo Public Schools. And I am not a graduate of Buffalo Public Schools. I moved here in 1979 to go to Buff State, and then I never left. So, so I'm happy to be here too.
I'll go first. So I'm Danielle Grismala. I am newly this year the co-chair of BPTO. I also am a graduate of Buffalo Public Schools. I graduated from City Honors. I have an 8th grade son at City Honors currently.
Greg Grismala, Danielle's husband.
Mr. Daniel.
I help out BPTO when I can. And as Danielle mentioned, our son goes to City Honors. I did not go to school at BPS. I went to Western.
We'll forgive you.
We have 2 online.
Okay.
So we have Stacy, would you like to unmute and introduce yourself?
Good morning, Stacy Bisker. I have 3 children currently in Buffalo Public and 1 a recent grad.
Morning, Stacy.
Good morning.
Okay, and John?
Good morning, everyone. My name is John Gonzalez. I am the new Associate Superintendent of School Leadership in Buffalo Public Schools. Very happy and proud to be a part of the Buffalo Public Schools. I am a former student of BPS. I attended School 33 and School 63, which is no longer around. I'm just glad to be a part of it and be able to participate and listen on to your work. So thank you for the invitation.
Good morning. Thank you so much for being here too. So what we're going to do right now is try to stick very hard to our agenda and jump right into our guest speakers for the morning. What we wanted to do for today's meeting was to focus on attendance this year, in part because we're coming off of such an unusual, really unprecedented, right, year of primarily online learning, and so being back in person, you know, has both a feeling of excitement and some challenges, some significant challenges. So, you know, we wanted to ask both Dr. Sharon Brown from the Division of Student Support Services, and Ms. Laura Samolsky-Peters from the Office of Shared Accountability to come and talk to us about attendance from two different perspectives. So on one hand, we'd like to know just about how things are going for this year, right? And the move generally back into in-person instruction at vis-a-vis attendance, what we might do as parents and teachers and others in the community to support and uplift that regular attendance. And then we also would like to know more about attendance regarding COVID protocols. So, because it is such a strange and unusual time, what is it that we need to know about attendance and, our kids being back in person while the pandemic is still ongoing? And so I would like to turn it over to the two of you and say thank you so much for being willing to take time out of your Saturday morning to come and provide us with this information.
Yes. So, good morning, everybody. So we already introduced ourselves, but what I would like to do before we start the presentation, if you don't mind, is just explain how the Office of Shared Accountability and how student supports, what piece of attendance we're each working on. But I will share that Dr. Brown and I, Sharon and I, we talk almost every day, multiple times a day, really, because attendance every year is a challenge, but this year in particular, in a lot of ways, is more difficult than last year, right? Last year we were home, taking attendance wasn't a big deal. This year we have lots of moving parts that make this very challenging. So I'll start from the Office of Shared Accountability. Really what I do on a daily basis is try to make sure that our attendance data is clean, that we're not making mistakes when we take attendance, that we're reporting our attendance accurately to the state, and that when we say this is our attendance rate, our daily attendance rate, it's accurate. It's really giving a true picture of who's coming to school, who's not coming to school, and then we kind of have partnered with working with the attendance teachers to then get supports in place for students who need support getting to school. And that's where student supports takes on the other half of it, the people aspect.
All right, so just as Laura said, we are partners in this work. So we meet with the attendance teachers weekly. We just met with them yesterday. So our division, the Division of Student Support Services, we work with our attendance teachers to support attendance. They're one entity amongst a larger system. So they work with the school team. And it is really our focus. And as we go through our PowerPoint slide, we'll show you in terms of what does that multi-tiered support look like. So we have the school teams, we have our attendance teachers, who are really addressing the most neediest students and those who are in a critical situation where they've missed several days of school. And so we just recently transitioned our division for the Division of Student Support Services. Attendance now falls under the direction of our temporary director, Andrea Sanders. She is in charge of crisis prevention. So we have a crisis prevention team. And we said, we really feel like attendance needs to be under that department, because if a student is missing several days of school, they're in crisis and the family is likely in crisis. And so we want to wrap our arms around the entire family and to support them. So as we take you through these slides, we just wanted to give you a little bit of a context in terms of how we work in our department.
Okay, so let's start off with taking attendance, the actual record keeping. So this year, we really made an effort over the summer to sit down and think about what policies and procedures could we put in place in the Buffalo schools that would ensure accurate attendance taking. One of the things that we found in the past, and this is not really anybody's fault, it's just how it was that not every student had an official class on their schedule where attendance was like the official record, right? Especially in our high schools, there were times when if your first period class was your first class of the day, that was your homeroom, and then maybe that would be your record, maybe you had a homeroom period. It was just kind of not a uniform procedure. So this year, we made a policy that every single student has to have a homeroom on their schedule. So if you look at a BPS student schedule, you will always see HR somewhere on that schedule And that is the official attendance record for that child.
Excuse me. First of all, my name is Frederick Phelps, for the ones who don't remember me. I've always been at your meetings, but whoever's driving a silver Benz, the yellow lights are on.
I would break that. You know what?
2021. Laura's got you.
I
Go
got you.
ahead.
I don't want a dead battery. So why is that important? So now I can always have an official record of when the child is absent, present, or tardy to school. It's always marked in that homeroom period. From my office, when we need to pull reports on the whole district, I don't need to guess where the official homeroom attendance record is. I pull from that period. That tells me who's in school, who's not in school. It also helps me understand who hasn't taken attendance yet. So, right, some teachers might forget to take attendance. We also have lots of substitutes on a daily basis. Chris shared that with us, right? Substitutes can't go in the system and take attendance. They have to give the attendance to the school clerk, and the school clerk puts it in, and we're all humans. We forget things. It's very busy in the schools. So every day this year, this is something new. We have designated a person in my office who calls the schools and says, these homerooms have not taken attendance yet. Make sure you get that in the system so we know who's here, who's not here. And by the way, there's been several days when I've made those calls to schools because you know how it goes. People are not at work, people are busy, whatever. But it's really been a priority of ours to make sure that people are taking attendance. We're notifying families when kids are absent or tardy. So there's robocalls now that are going out every day, notifying parents of kids that are absent. And our data is cleaner because we're really making an effort to make sure that we're taking attendance and we have an official record.
Can I ask a question?
Sure.
From a teacher's perspective, like in the past, you would have to fill out your beds form, which was based on your homeroom, right? Because you were the teacher of record for those children. So I'm a little confused about this. Okay, so how does this new system, I guess I don't understand how teachers were not taking attendance for those kids that they were accountable for in their homerooms, because everyone was designated certain
That's a really
students
good
that they're
question.
accountable for.
So in the elementary schools, their homeroom is really the kids that are assigned to me, like as my face, 25, 30 kids, right? So those would be the kids that an elementary teacher would fill out their beds form for. For 7 through 12 though, you don't just fill it out for your homeroom because you see so many kids throughout the day. So there would be like 5 different classes on the beds form and you would fill one out for each of your classes that you saw, not the homeroom. So
Okay.
yeah, it didn't really, they didn't need to have an official record homeroom on there in order to do the beds form.
Okay, thank you.
Yeah, no problem. So one last thing that I want to talk about in the attendance period is, of course, we know we have students coming to school tardy, right? It happens. People have things that go on in the morning. I'm tardy sometimes, I know that. So when they're marked absent, when they come to school, if they come in at some point during the day, the school goes in and changes that absence to a tardy in the homeroom period. So we have an official record of it. Okay. So then we calculate how many absences kids have, right, for the amount of days that we're in school. So when we talk about on the second slide, the attendance categories, those are based off of how many days we've been in school. And it's really what we're calculating is what we call their ADA, their average daily attendance. And it's a formula that takes into consideration how many days we've been in school and then how many days a child was absent. So I can't give you an actual target to say if your child misses this many days, they'd be in the severe category because it changes every single day, right? If we were in school 10 days, 20% would be 2 absences. When we get to 20 days, it would be 4 absences. So I can't give you a target goal. But what I can say is if your child is absent more than 20% of the time, they fall into what we call the severe category. If they're absent between 10 and 20%, they're chronic. If they're absent between 5 and 10%, they're at risk. And if they're absent less than 5% of the time, it's considered satisfactory attendance. And these cutoff points were defined by the state. So for accountability purposes, schools, not children, but schools get labeled with these labels as well. And these are the cut points. So we just applied those same cut points to kids to apply interventions. Does anybody have questions about these?
I do have a question about that. So does this refer only to unexcused absences or is it also excused?
This is a
absences?
great question. It actually calculates both. So as far as the state is concerned, an absence is an absence, right? Now, we know that there are times when kids can't come to school, when they're not feeling well, when they are, maybe they have a doctor's appointment, they have to, something like that. That's why the 5% is built in there, because it's reasonable to think that a child could legitimately not be in school 5% of the time, right? So that's how the state calculates it. They don't consider excused or unexcused. They do, you may have heard, especially since COVID started, we have a thing called exempt absences, right? So as far as BPS is concerned, exempt absences do not count towards this. So let's say your child, last year we had some kids that didn't get devices right away, probably this year as well. But last year it was more, I don't want to say important, but it was had more of an impact on attendance because we were home. And if you didn't have a computer, you couldn't log in and do your work. We counted those as exempt absences. So no student could fall into the severe category because they didn't have a device rather. However, the state would consider it an absence. Okay, they wouldn't say, oh, we get it, you didn't have a device. But that doesn't go against your child. That counts against the school. Okay. So the next slide has some attendance interventions that student supports has in place.
Yeah, so here, and I apologize that you can't really see this clearly, and we can send you a more cleaner copy, but our attendance.
We'll put it on our Facebook page too. We can put
Okay,
this
great.
So you can look at it.
Thank you. So we have a multi-tiered system approach with our attendance teachers. Again, as I was saying earlier, they work within a team of individuals, and at the school level, as you can see, tier 1, that's the support for everyone, including the students who have chronic and severe absences. So we have attendance supports at the school level, support that with PBIS interventions. They're doing maybe incentives. They're constantly promoting attendance and the importance of it. They're sending home communication to the parents to say, you know what, we really want to support you. We want to make sure your kids are in school. Then we start seeing at the level 2, where students are missing school, but it's not at the severe and chronic levels. That is when the school support teams get involved as well. And even at the tier 1 level, when we're seeing absences, schools are calling. We have a robocalls that go out. And I know sometimes the robocalls is a lot, but we really want to make sure that you're getting that information that you need to make sure that you know where your children are. And if we have any errors with that, we always want to know. But those tier 2 interventions, that's when you get your student support team involvement. The teachers meet during grade level meetings and discuss the students who are missing school and how we can support them. Also under the Division of Student Support Services, our school counselors, they're working very closely with our teams as well. Then when you get to that tier 3 support, that's when attendance teachers really need to get involved. They're doing home visits, agency referrals. Sometimes there are restorative practices conferences, because again, we want to just restore what has perhaps been lost in that process. So this multi-tiered approach is really, really important. And the parent is the center of the support, because we also want to make sure that we're looping in the parents. And that's where our Office of Parent and Family Engagement, they have offerings that can help support parents when they're struggling in areas. And we're continuously building that.
Sorry to interrupt, Stacy asked, when it counts against the school, speaking of absences, are you speaking about financially against them or otherwise?
So That's a really great question. There's actually two ways that it counts against the school. One way is for accountability purposes. So I think we all have heard the names have changed in the past, but right now we have schools in good standing. We have schools that are CSI, TSI. Part of the calculation for that is with these attendance categories. So schools who fall into certain attendance categories, it helps them go into that accountability determination or designation. So that's one way, and that's the way that I'm most involved with. There is a calculation that comes from a different office, from our financial, our finance office, that does take into account schools' attendance, and then it could impact our funding. I did have a little involvement with that this year because last year our attendance was a little bit clearly impacted by COVID, right? So we did see some drops in attendance last year that the state is talking to us about. I don't think it's really going to end up in us losing a whole lot of funding. So I don't think it's, although they do factor it in and they do look at it for finance, I don't think we've come to the area where we're really losing funding because of absences. And especially now in a pandemic, I think the state is being very, they're understanding of the challenges that we have right now with people coming to school in the middle of a health-related crisis that our whole world is going through. So I wouldn't be too concerned with the funding impact as much as the accountability impact, because when a school becomes CSI and TSI, there's a lot of extra things that the school has to go through on a daily basis than if Buffalo Schools is calling me.
I got that too.
The robocall.
Yeah.
I love when I think I hear the bonus voice on the phone.
Issues popping up,
It's everywhere.
Trying to keep the lines of communication open. And just also to piggyback off of that, that's why we're really promoting the communication. Because again, we don't want to say, I gotcha, or we want to see any type of consequence. We want to work together as a team. And just please, when we reach out to you, and sometimes the attendance teachers will say, we can't reach you, they're not following up, you're not getting a call back. Sometimes, I don't always answer my phone, I don't recognize the number. I mean, I don't, I think it's, just
Getting one
a
of those
sales call or
robocalls
something.
now.
Yeah,
Exactly.
we're all dialing through.
So if we just can encourage parents to, listen to the message and try to call back again. We want to just hear what is going on in your life and how we can support. So that's a good segue into the next piece in terms of the COVID protocols that we have. And the COVID protocols are here to make sure that students and families feel comfortable entering the building. We realized that we were 18 months out of school where the whole entire school population was in the building. So that is a huge shift. That can be a social, emotional impact on the student as well as the family. So I just want to give you a little bit of context as far as to some data points. Okay, so the new COVID cases since October 16th are 1,818 in the county. Hospitalizations, 229 as of 10/10. That's all that they had on the site at the time from 10/10. Deaths in the past 7 days, 2,062. 530 of them were in Buffalo. And then just a vaccination status, because again, we're also trying to promote prevention as much as possible. So right now in the county, ages 12 to 19, and the students have received at least one dose, or the youth have received one dose, 25.3%. On the next page, so these are some of the attendance concerns that we hear, and certainly share with us if you have additional ones. What if my child has COVID? How will this impact learning? What if my child is considered a close contact? How will that impact learning? And how will my child access instruction? Will my child's attendance record be negatively impacted? What if there is a language barrier? And I don't believe it is safe to send my child to school. So hopefully we will answer these questions throughout our presentation. So we just want to share with you some of our COVID-19 attendance supports. So if you have a confirmed COVID positive case, or those students required to quarantine are eligible to receive concurrent remote instruction. So that is something that our district is really promoting. It gives the child an opportunity to be online with their peers. It's a little bit different than last year where it was asynchronous versus synchronous. Asynchronous, there was time off the screen to do independent work. This is, they participate the full day online. That is if a student is well enough to get onto the screen, we promote that. Therefore, attendance would not be impacted at all. It's just something in-house that they have to do to put them in a virtual bucket to be able to identify that they're not physically in the building. So therefore, there's no impact. Addressing language barriers. Our multilingual department has a wonderful online tool. It's called Talking Points. So say I text a parent, I text in my own home language, they receive the message in their home language, then they're able to respond back. And so this is something that we're also going to explore with our attendance teachers as well, just to make sure that we're all on the same page. So therefore, if there is a language barrier and they're having concerns in the household with attendance, they're able to communicate with the schools. So you asked about earlier about mitigation strategies. So in order to address that concern about, I don't feel safe sending my child to school, or I'm afraid my child may get COVID. We have a number of strategies within the schools. We also have a medical team that we meet with on a consistent basis. We have 3 medical doctors. We had 3 nurse practitioners. We're actually going to be filling in the 3rd position very soon. And that the nurse practitioners, their role is to be a conduit, a liaison to the Erie County Department of Health. So they go between the Erie County Department of Health, they get the report that the child is positive, they report it to the school principal, and there's a whole process with that. But also, prior to getting to that point, we want to make sure that we have some measures in place to make sure that students are safe. So our team, and also Dr. Tandra Williams, who's the Associate Superintendent of Student Support Services, she's on the team. Mai Wen, she's the Director of Social Emotional Support, and I am on the team as well. And so we talk about how can we ensure that our students and the staff are safe as much as possible. And we look at data and we talk about what needs to be changed, what needs to be modified. So here are some of the mitigation strategies. There's a daily temperature and health screener that we ask that families complete prior to sending their children to school. It's one question, but it's pretty loaded. So it asks if you have different symptoms. If you have any symptoms, we ask that you not come into the school building. Again, because you don't know if you're COVID positive, we want to ensure the safety of everyone. And that's not only for the students, but it's for the staff, and it's also for any visitors. Right now, we are not honoring any mask exemption requests because we are still in a high transmission rate. We're in what we typically used to call the red zone, but it's a high transmission rate. And until we drop to the orange level, we can then consider some of the mask exemption requests that we have received. So again, those families who ask for a mask exemption request, if their children cannot go to school with a mask, we've offered the concurrent remote instruction. Also, some other mitigation strategies are masks are required on the buses at all times. Strongly recommends daily seating and attendance charts, and we already have that in place. The schools have attendance charts and seating charts because if there is someone who is identified as positive, they can see who is sitting within 3 feet of the student. We have an isolation room. We want to call it the CARES room because, again, the word is self-isolation. We want to make sure that we're very sensitive to the needs of our students or adults who may have to go to that room. If they fall sick during the school day, that is where they report to until they can be safely picked up. Also, we have contact tracing for positive COVID-19 cases. So the principals and the other representatives within the school building, they have been identified to assist with contact tracing. And what happens is if there is an identified case, which you'll learn more about, we do have weekly testing going on in the building as well. But when there's a positive case and the student is in the building, that student needs to be immediately isolated. So they report to a supervised cares room until they can be picked up. And then at that point, the principal or the designee, they began to find out who was near the child, who was within 3 feet, if it was on the bus or in the school. And so that's where the contact tracing comes in. Also, weekly COVID-19 screening tests. We are encouraging you to please sign up to consent to testing, because that is a really great surveillance way to just monitor this on a consistent basis. So when you ask the question, is my child safe? It's really great that we have these systems in place that schools are constantly just see, you know, you're not having any symptoms, but we just want to check to make sure that you're not COVID positive.
Sharon, can I have one
Sure,
one
jump
thing
right on
just that goes along with is my child safe? If people aren't aware, there is a COVID tracker, we call it, on our BPS website that shows you where the positive cases were and how many people have been tested. So you can see that we're doing testing, you can see how many people have done the testing and where the cases are. But what I want to say is, please, I get a lot of emails about this. The positive cases, before they can go on the tracker, have to be confirmed by the Erie County Department of Health. So sometimes our data isn't, you hear that there was a positive case in your child's school because the letter goes home immediately, but it has to be verified by the Department of Health before it comes to accountability and gets added to the tracker. So there's been a couple times where there was a little delay there, and people got
saying that, because that definitely comes up
All the time.
Yeah,
Yeah.
and I know you mentioned city honors, and I hear from many parents in
Yes.
city honors who say, I got a letter saying there was a positive case at city honors, but it isn't appearing on the tracker yet.
Right.
And that's when I explained to them, we have to really have that verification before it goes on the tracker.
Yes, excellent point. I'm glad you brought that up. And also Erie County Department of Health, there's a lag in their reporting. So it does take a while. So that is exactly what Laura just described. That's why you do see that delay, and it has to be confirmed, because there have been cases where someone is experiencing symptoms and they say they have COVID. They just believe they do, but they never got that confirmation. And then later on, they'll find out that maybe it was the flu. So that's why we definitely want to make sure that we confirm it. And so the next page, just a visual of what we're doing. We have to have a the form signed in order to conduct the testing. And once that happens, the building principal and the nurse, they work together as partners to get a schedule out and to get students and staff tested as much as possible. And then if there's positive cases, I just shared, that's when the contact tracing begins. So I'm going to give you just some definitions. So a close contact, how that is defined. An adult close contact is individuals within 6 feet of someone who tested positive for COVID, and they were within that space for 15 minutes over a 24-hour period cumulatively. And then for students, it's within 3 feet for the same amount of time, or over 15 minutes over a 24-hour period. So adults should always be within 6 feet apart. Students, 3 feet, and this comes straight from Erie County Department of Health. So that's why in the schools, we had individuals from the plant department making sure that they're positioning the desks the way they need to, and the adults are 6 feet away. And please stop me if you have questions. So if you have COVID-19 symptoms, okay, so this is, you haven't been confirmed that you're positive for COVID, you haven't been identified as a close contact, you're just at home, you just don't feel well, you need to stay home. This is what we've been constantly expressing to everyone. And I want to add a little piece to this as well. When I talked about the surveillance testing in the school, that's fine, you can continue to go to school. But let's just say you're home, you don't feel well, you get a test, or you find out that you were with a friend who tested positive and you believe, I was a close contact, and you get a test. You're not to report to school for those reasons either, because you're getting your test for a different reason. You're getting your test because you have strong belief that you have COVID, because you have symptoms, or you've been near someone, you've been identified as a close contact. So what I'm sharing now doesn't include those two scenarios. So the first one is to stay home. So individuals who show symptoms must remain home from school for 10 days, but may return early with a negative PCR COVID test or a note from a doctor. So there are two types of COVID tests. There's a rapid test, the one that is not as invasive, so it doesn't go as far up the nostril. That is not considered a valid test to come back to school early. The PCR is the one that is more invasive. That is the one that we're doing in the school. Now, of course, you can't go to the school to get the COVID test because you can't enter the building. But I have provided a site. We've provided a site for you to click to see all of the locations near you. Okay, any questions with the symptoms?
So I just want to,
I'm so sorry.
I-
So can I just ask a question? So Cece asked about, when we were talking about the students versus the adults, 3
Right.
and 6 feet. What about adult students? What do we consider? Would they be the 6 feet or? do they
Yes,
fall under
6
the-
feet. From adults have to be 6 feet away from.
What
the
about
school.
adult students?
Adult
students
students?
that
Oh,
are
that's a
adults?
very good question. It should be 6 feet. So you're talking about like an adult learning center?
Adult learning?
Yeah.
or- Yeah.
Yeah, but like our students, because we do know they're high school students who may be 18 years old in high school, they're
Oh, she
They're-
says she needs seniors.
seniors,
Seniors,
yeah, but they're following the same. three
So they're
feet.
considered
They're in a K to 12 school,
students.
yes. Okay.
So as far as this slide goes, what I just wanted to
Thank
quickly
you.
add is, please make sure that you are communicating with the school if your child is symptomatic, so we can code their attendance appropriately. Of course, we're gonna keep it confidential. It's not gonna be visible in the system, that's why they're staying home, but we wanna make sure that we're coding it appropriately as a, excused versus unexcused, so that we don't go back to this attendance category and have a child fall into one of these categories inappropriately because they had to quarantine or because they were waiting on a COVID test or something like that.
So a positive COVID test, close contact. So just as Laura just said, contact the school to share the positive results. It's really important. We really need that physical documentation of that. Again, as I said earlier, a lot of times Erie County Department of Health, and they shared this publicly, in touch with it. They have shared this, that they're really behind. So your lab result is very important to us. So you can scan it, take a picture of it, email it to the principal, that would be great. So once the positive case is confirmed, the school identifies potential close contacts. So that is when that school will begin to speak to the student just to find out, who are you close by? But again, they're looking at that seating chart to really help them to identify who those close contacts are. Once they identify that, that goes on the Erie County Department's contact tracing form. It gets sent directly to the nurse practitioner. The nurse practitioner is working in consultation with that principal to make sure that they understand what close contacts mean. We still have schools that have not had one documented COVID case. So definitely with those schools, they want to work with them side by side virtually to be able to identify who those close contacts are. So if there's a confirmed positive case, they remain home for isolation or quarantine requirements. So this is the part that we want to make sure that you understand, because it can impact attendance if we're not doing it in the way that we should. So once that principal knows that that student is positively confirmed, they definitely communicate with their school clerk, who knows to put them in a virtual bucket. So let's just say for some reason they don't have their laptop or they haven't received it, which I think we don't have that problem right now. I think they've all been disseminated. But that child would be coded a different way, but they're offered the concurrent instruction, as I mentioned. But we also want to make sure that the principals will notify the teachers to let them know to access that concurrent instruction. But because we are not official contact tracers, we're really working on behalf of ECDOH to help mitigate the spread and to be able to isolate and quarantine individuals for them in a potential kind of way. So let me just explain. So if there's a student who is identified, now the positives, they're real easy. But when you're identified as a potential close contact, the Erie County Department of Health contact tracers will have to call the parent to find out a little bit more to identify, are you truly a close contact? So our nurse practitioners, they can really only go off of the lab test results. So once the individual gets tested, say you get tested October 20th, okay? That is the date of your lab result. So technically, you're out of school for 10 days till October 30th. But once that contact tracer digs a little deeper and asks a few more questions, they may find out that they were symptomatic 2 days before. So that cuts their days down for the 8 days that the nurse practitioner said. But because we want to be as safe as possible, that nurse practitioner gives the principal a range of 10 days, which it could be shorter. So when Erie County Department of Health calls, they may tell the child, you can go back sooner. But because they're behind, it may take 2 to 3 days. We just recently reminded principals to send out like a timeline. So if you haven't heard from them, there's a number that you can dial that the principal will give you. If they don't return the call, that's when our nurse practitioners will call ECDOH.
So I just want to go back to a minute or so ago, Sharon mentioned the virtual bucket. That is in our record keeping system. It's so important that we're doing this accurately because the state is requiring us to report when students are learning remotely at home versus in person in school. Last year, that's how they did the calculations for those PEBT benefits that everybody received. I don't know yet if that's happening again this year, but if it does, we want to accurately give parents credit for students when they're learning at home. So it's so important to get the message out there that we're communicating with the school when a child is going to be learning from home because of COVID protocols, so that we are accurately reflecting that in our reports to the state.
Can I ask a clarifying question about that? Because we get a lot of questions regarding the pandemic EBT benefit card, right? So for anybody who doesn't know, which I don't know if there's anybody, but maybe, the pandemic EBT card is available to all Buffalo Public School students, right? So because of the threshold of poverty that we have in our city and that our children experience in Buffalo Public Schools, all children are now available for that pandemic electronic benefits transfer card. But the exact formula that's used for each child is based on partially on their attendance. So that is why you could potentially have like 3 children at the same school in the same grade with varying levels of attendance that would receive different amounts of money on that benefits card. Is that correct?
Almost. It's
Okay.
it's based on when they're learning remotely.
Okay.
So my understanding is when you're learning remotely, the parent is providing food
Yeah.
for the children that are home. So when we code a child as learning remotely, that does have an impact on the PEBT because it
I see.
increases
Okay.
how much, and I don't know the formula, the state does that. What I do is I make sure that if the child learns remotely and it's coded appropriately in our system, in Infinite Campus, I make sure that data makes it up to the state, and then they take that data and calculate the benefits. I do know that many people have contacted my office about benefits being incorrect or not receiving the benefits. That's fine. You can continue to do that or contact Dr. Krusty's office, and we're working together with him. There is a PEBT form that you can fill out with the state if you have, if it's incorrect or if you did not receive your benefits, and I'll get you the link to
That
that
would be
state
great.
form so that parents know they have that, or they can just call Dr. Krusty's office and we'll check what was sent up to the state and make sure it's correct. There's been a couple of issues with like a birthday being incorrect at one of our charters or something like that that impacted the PEBT, but we have a mechanism in place to get those corrected as quickly as possible.
Terrific. Thank you.
So for the students that fall into that virtual bucket, how is attendance recorded for them?
So that's a great question. It's pretty much the same as in person. They are on the teacher's roster, but the teacher will see like a list of kids who are expected to learn in person. And then underneath it will be a list of students that are expected to be learning virtually. And then the teacher just goes in and marks whoever's absent. So if the child doesn't log in for the concurrent instruction, they get marked absent right on the same roster.
So that was my second part of the question. So if they don't log in, then they're considered absent. which
Correct.
Could increase
Mhm,
absentee numbers.
yes, and we did see that from last year, where some kids didn't log in. Although we had a different rule and they could have done asynchronous learning and gotten attendance credit for it, but, you know, the pandemic really has impacted attendance, yeah, which was to be expected.
Yeah, I got a couple questions. Do they automatically get these cards in the mail? Okay, that's the first question. Now, if a kid goes out for 10 days, would they get money funding for that 10 days or no?
So I don't know the formula the state uses, but we are definitely wanting to keep accurate records of when a child is learning remotely, so that whatever formula the state uses to calculate, they would take those 10 days into consideration when calculating the payment.
And do you find that this might make parents want to keep their kids home? I mean, if they're getting,
I honestly haven't
No?
really come across anybody who has taken the PEBT into consideration when keeping their children home. What we're coming across more is parents who just are concerned for safety and they don't want their kids to get sick.
Absolutely, absolutely. And then even if there's a situation where the child does not log on, we really want to communicate with the family and find out, is there something go on, or they weren't able to get access, because you can always go back and correct something if we find out other information later. So we always want to err on the side of caution for the child and do what's beneficial for the family.
I just have one quick question, and you two may not be the people I should be asking this question of. But we know that concurrent remote instruction is not the ideal situation for learners at home, right? Online learning is its own form, and it can be done very effectively. But turning a camera on in a classroom so the kids at home are tuning in is not necessarily best practice, right? So is the district looking at other ways of addressing remote learning besides concurrently?
So that's a very good question. And for concurrent remote instruction, for some learners, we're finding we've actually spoken with some parents who have said that their children are thriving in that environment. We do understand that there could be challenges for the teachers. And so our curriculum department, they're there to support. We've reached out to the principals to say if someone needs to come into the classroom, and also individuals from our technology department. So we understand what you're saying about the background. So we are encouraging families, because we have a lot of virtual background screens that we can always put off, because we definitely don't want a child to feel uncomfortable if they're at home or they don't want to see something in the background. So we always promote that. There are just some like virtual guidelines, what we're asking for. So we always continuously promote that and want the teachers to do so as well. This is the world that we're in right now. You know, what we've been dealt with the pandemic is nothing that any of us ever wanted to have happen. However, we are trying to find ways to be able to properly as we can educate our students in a way that is conducive to what's going on. If they're COVID positive, and many of the students who have been identified as COVID positive, some of them are asymptomatic or have very mild symptoms where they can continuously engage, because we're trying to accelerate the learning and try to prevent that learning loss. And so that temporary situation with the concurrent is right now what we're exploring. If you're referring to like mask exemption requests, I know we've been working very closely with Kim Hosher's department. She's the assistant superintendent over special education. And she's been creatively working with her team, speaking with families, seeing how we can do some portions of in-person for students, because there are some students who can tolerate a mask for a certain length of time. Therefore, they can get their related services that way. So we're really trying to explore all avenues and certainly continuously give us feedback to tell us how we can do better to be able to meet the needs of the
Dr.
students.
Brown, if I could just add also, there definitely have been conversations, because what we know is that As Dr. Brown said, there are some students who thrive in that sort of learning environment. So what we're looking at are ways to really bolster the support and the professional development provided to our educators who are delivering the remote instruction. So that is the piece that, I know that there's conversations around providing the additional PD, because I think that is what is the critical piece that we need to focus on. So obviously, when we transition into the remote learning environment, we all kind of did, it was kind of like an emergency sort of situation, but now we have the space and the time to really provide the quality professional development that will help to make all educators who are delivering the remote instruction, top of the class.
I understand and I appreciate all of that conversation, but I also know that delivering remote instruction is its own art. And a teacher really who is teaching live children and remote children cannot do her best at both, or his best. So that's what I've been thinking a lot about and looking at other districts, some of whom hired staff just to teach remotely. And this is a second grade remote class, and kids get the link to go into that, so that it is a true remote learning versus concurrent. So that's what I'm really trying to get at.
One little thing, there is a conversation happening right now to try to discuss additional options that are not just concurrent.
Right.
Because for some kids and for some teachers, that's not working out, but it is in its early stages. So,
Cool. Great.
I'm not sure where they are with that, but I do know the conversation is starting to happen to try to offer another alternative for students who are unable to be in the building.
Definitely, we definitely want to hear more feedback in terms of suggestions, but yes. Other questions? And then we're almost to the close, so then just quarantine exclusion. So there are some individuals who do not have to be quarantined because they've been fully vaccinated. So if you're fully vaccinated, which means 2 weeks following your second or final dose of your vaccination, you're considered fully vaccinated, you would not have to quarantine. However, we do recommend that you do get tested, but again, it's not a requirement. And also, if you are identified as a close contact, you would have to quarantine. And also those individuals who had COVID within the past 90 days and they have absolutely no symptoms, they would not have to quarantine. And then finally, vaccinations, we are just promoting that. We have had some really successful school-based vaccination clinics, some on Saturdays. We also went out to sporting events. So we're really trying to get the word out, vaccination. And not only vaccination, we're really trying to focus on the educational pieces as well, because we know there's some fear out there. And we want to dispel some myths. So that is what we're working on. We have had a number of schools participate. Some principals reached out to me recently. They want to be considered a site. So again, if you have any questions, and then we provided you with a link and a phone number where you can also do this on your own. Now,
I just want to say that phone number, you can also call that to schedule a COVID test for your child at that number, 858-2929, as I know from personal experience.
Thank you. Now, any additional questions?
I noted.
Yeah, so thought we could grab it. So Stacy had to leave. She did have a question going back to attendance, when we were talking about taking attendance. She was asking, is attendance for non-compulsory ages / grades also factored in?
Compulsory.
Oh, I was like, I don't know the word.
Well,
compulsory.
yeah.
The answer is yes.
I haven't been
Typo.
So what she means by non-compulsory is, in New York State, you have to be in school between the ages of, I know I'm gonna get the lower one wrong, I believe it's, I'll say 5 and technically 16, but many districts put a policy in place, including Buffalo, to make it 17.
Right.
So that's the compulsory school age. But if you're 18 years old, your attendance still counts in all of our calculations. We don't just use compulsory school age kids in our attendance calculations, but that's a great question.
Okay, I will get that answer to her because she had to log off. I thought we could sneak it in before she logged off.
Couple more questions. So we know how many students so far have been diagnosed with COVID for this school year. Do we, and I meant to ask the superintendent this in our board meeting the other night, I forgot. Do we have any data on how many students have been impacted by quarantine because of close contact?
Very good question. And we do have that data. Our nurse practitioners have that data. And we would have to pull that. Because what happens
Like
is-
do you have like a guesstimate of, because it seems like I work in another district, there's a lot of kids that are being impacted by this being put in quarantine. Because of close contact.
we can definitely get you that data. The principals, they work with trying to identify the close contact. And it goes to, because those are preliminary data points that we have, that we give to the nurse practitioner, and then Erie County Department of Health has to co-sign it and reach out to confirm it. So we can work on getting those.
And like the second part of that question, which you probably don't have the answer to, probably need to guess. Dr. Full question. How many students that have been deemed close contacts and put in quarantine have actually developed COVID?
Oh, wow.
I'm hearing it's not very many, if almost none at all. So I'm wondering if at some point, if our COVID rates is stabilizing, sort of decline, and we need to revisit quarantine procedure. And I know that's beyond us.
Right,
It's up to
exactly.
health, but
And they've been talking about revisiting some of these procedures as well, in some of our meetings with Erie County Department of Health. And also the other piece of that is that many of the families, the students who are quarantined, they're not getting tested. So they may just remain asymptomatic. And so that's why you can never get out of the close contact, how I explained with COVID symptoms, how you can get out of the 10 days if you get a test. But once you're in close contact, because you can develop symptoms within the 5 to 10 day period. So, and you may be asymptomatic with this. Those are excellent questions.
There's a lot of complaints about that in Buffalo too. The teachers, a lot of the teachers are complaining because if a kid comes in and he's coughing or sneezing, they're supposed to send him to the nurse, then he's quarantined for 10 days, he's missing school. And then I've also heard that siblings are still going to school because they've been vaccinated. They don't necessarily have the symptoms, but they're in the same house with a quarantined kid, you know?
Well, technically, because they've been fully vaccinated, and that's what the advantage of being vaccinated, because it doesn't require you to, not only because you don't have to be considered close contact, it's also for your health. But no, that is correct.
it would apply to staff too. You have a
Absolutely.
family member at home that is COVID positive, you could still report it.
Well, some of the symptoms, though, like I have bad allergies, because I've got cats and a dog, and, you know, I'm always wiping my nose, I cough, you know.
Yeah, that's really been a challenge. As a parent, I'll tell you, my son also has allergies and asthma, and quite often I get the call from the school that he's coughing, and I know it's asthma, and then he has to have a COVID test to go back to school, and it's been
It's crazy.
for 2 years, you know, he was in school last year too, I've been dealing with this, and it's just, unfortunately though, to try to keep people safe, we can't be trying to self-diagnose, like, I know it's his allergies, but what if it wasn't? What if it, you know, I can't,
Right.
I'm not a doctor, I can't do that, he has to go for the test.
And in some cases too, because it is documented, we talked to Dr. Cole about this as well. So if you have a doctor's note, the doctor can write a note to verify that this is what it is, then the child can come to school. Because you're right, some people are just chronic allergy sufferers.
So this 25% of ages 12 to 19 with one dose seems low to me. It doesn't,
Yeah.
like, why?
With at least one dose.
So I believe that many parents have heard from colleagues and are nervous about the effects of a vaccine on their children, right? I've heard many people say things like, well, the kids don't get sick. So why are we putting this? And of course, there's so much misinformation out there that it's really difficult as a parent to make that decision about your child, especially when you hear these stories out there about negative effects, especially with the boys and things like that. So I think that I'll share my personal struggle. My son is 7. I know it's gonna get approved for 7-year-olds in the next few weeks, and I have to question myself, like, is it safe? I'm talking to his doctor, what's better, a vaccine? What do I do for my son? What's the best choice? I think a lot of parents are struggling with that, and I think that's why we're seeing those low vaccination rates in children.
And that's what I was saying earlier too, the education with it, because there are a lot of myths out there too, that we really have to dispel. And again, you have to make that decision for yourself as a parent with your doctor. But based on the information we're receiving from our medical team, it is much more serious to not have the vaccination.
Yes, we're all stuck in this together until we get everybody.
And I just think the misinformation that's out there is really making people, and the fact that there isn't like one place that everybody feels like they can go to get an answer they can trust. Yeah, right?
Yeah, well,
We
that's
live in a
the
social
distrust.
media world,
Yeah,
and that's
people don't
what's
trust it.
happening. So I think a lot of people are just very nervous. Those are our babies, right? We're nervous. We want to make the right decision for them, but we don't know who's the expert to tell me what the right decision is. So I think that's why we're seeing what we're seeing.
I think another factor too, from my own personal experience, me and my daughter both had COVID last year. We had to wait a certain period, even though she was eligible for the vaccine, before we can get it. And before we got it, I went to every doctor that she typically sees, because some littles, I call them littles in that age bracket, who had COVID may experience some heart inflammation. So that could be a reason why, and this is what her cardiologist told me. They were trying to determine whether or not littles who had COVID should get 1 dose or 2 doses because they already had the antibodies. So that possibly also could be a reason why the numbers are so low.
Good conversation.
I have a quick question as I'm building my knowledge about this. My freshman in high school got his shots. We signed off on him being eligible if they need testing. Because he's had the vaccine, does that mean he's out of the pool? Like, does that affect that usefulness of that test?
I'm sorry, can you repeat that? No, I just want to make sure I understand your question. Yeah. Are you talking about the weekly COVID test? Oh,
The screener.
absolutely. Yes, that's an excellent question, because what we found is that some people had rescinded their consent because they said, I'm fully vaccinated. We still, because unfortunately, we are hearing some breakthrough cases. So we still want to stay on top of that. So yes, please, I encourage you to continue with that. Now, what will probably happen is that that's when the principal and the nurse kind of decide with the priority with capacity. He may not be tested as often as someone who is unvaccinated. Yeah.
That's a really good one.
Yeah.
My son asked that same question, or made that comment. He was like, I'm vaccinated. Do they care that I'm tested? I'm like, yeah, I think everybody should go in the pool. So
Yeah.
Last
Thank you
year,
for
when the
asking that.
staff was vaccinated, we were still part of the random polls, even if we were fully vaccinated.
Yeah. So now we're not even trying to do random anymore. We're just really trying to do targeted. Because right now we have the data and it's telling us where to go and where the numbers are. So, yeah.
Thank you all so
That's
much for this
wonderful. Thank you for having
conversation.
us.
Helpful for us.
Yeah, and I think
Just recorded.
yes, we are recording this and we'll put it on. I want to also welcome Mr. Larry Scott, who is a Board of Education at-large member, to the in-person portion of the meeting today. And I'd really like to thank Dr. Sharon Brown and Ms. Laura Samolsky-Peters for providing us with all of this information. This is a brave new world, and a lot of us have questions. We want to do the right thing. We also are not always sure what the right thing exactly is because it is so complicated. And so thank you for all of your hard work in creating structures, policies that keep our children safe in this time of COVID. And thank you also for being willing to share that information and get us all up to speed on what we ought to be doing at home and as our children travel back and forth. We really appreciate it so much. So thanks again.
Thank you. Thanks for coming.
Thank you. All right, and we are not too far off the mark with our our plan for today. If you don't mind, on our agenda, we're gonna move first to do our Say Yes Buffalo update because Ms. Jelenia Smallwood is here to give that update, and I want to make sure that we stick to that, and then we'll move into all of our business. So.
Thanks, Rachel. So it's just a quick update from our Say Yes agency to items that I wanted to bring to everyone's attention because I used to work in this department and Betsy said, please share the scholarship update. So it's that season of all things related to scholarship, college application. So right now our scholarship team is in the midst of processing fall 21 payments for students. If a student has a hold on their account, please call Say Yes Buffalo. Betsy's number is 716-598-8593. And the reason why we're encouraging families to call is because we don't want students to be prevented from registering for the upcoming semester because their fall 21 Say Yes payment hasn't been processed yet. Also, if students or parents have questions about their award letter, call the scholarship department as well because you may not see the Say Yes scholarship on the award letter. You may not even realize your student has a hold on their account. And so we just want to try to minimize any issues that students will have going into the upcoming semester. The last update is that our team, the FAFSA team, as well as the Say Yes team is approved to go into the school buildings. So they will start going into the schools to be able to provide the assistance for not only the Say Yes scholarship application, which will be going live in a couple of weeks, but also the FAFSA support. I will also add from the community schools area, we are starting to host some FAFSA nights in our parent centers. Those are going to begin in November, and there'll be a flyer coming out with all those dates. And our last update is that we will be hosting again Operation Warm, which will be giving coats out to families. We've hosted this in the past. Last year we couldn't because of COVID, but we did smaller cozy kits. But we will be doing Operation Warm this year across all the 4 parent centers on November 11th, and then across all 24 community schools on December 11th and 18th.
Do you need donations for that?
We always accept donations. So last year we had some partners that donated. Of course, we take new because of COVID. We didn't do the gently used hats, gloves, scarves, because we have a mitten tree. We have 2 partners that actually donated coats to us. We don't have the quantity we had when we did it year before last. We had about 2,000-3,000 coats. So it was a really huge lift. Because of their demand, that we don't have as many coming this time, but we do have a nice amount that we are stretching across all the 24 schools. But we will accept donations of new items of warmth, the hats, the gloves, scarves, and socks, because we didn't think about that years before, but a lot of our students, especially our high school students, need socks, don't wear socks, so we include socks in those kits.
Jelena, could we go back to your first thing? As a mom with a kid who gets a Say Yes scholarship, can we still log on and see? There have been problems in the past couple of years where we couldn't always log on to the site to see the status. Are we able to do that now?
I would contact Betsy. I used to be in the scholarship department. It's been removed, but still so connected to it because I can't let it go. But I would contact her. I know they've been making updates to the system. So if you're still experiencing those issues, I would contact Betsy to see if she can help troubleshoot you being able to access. Because if you're a parent of a student who's already gone through the FERPA policy and all those, you should still be able to access your student's account, your Say Yes student account.
Right.
Now, the college account is something different.
No, he and I got that down.
Okay.
But Say Yes is always it's the rogue element, like, are we gonna get it? Are we not gonna get it? But I mean, he has gotten it in the past, so my understanding is as long as we do the tap and the FAFSA, it should continue.
Yes, absolutely. But if you are having trouble with the tech keys, contact us.
Okay, thank you.
Any other questions?
Thank you so much. Thanks for
Thank you.
for being here and being willing to come out on a Saturday morning to let us know about all of this.
Schools, so it's okay.
Yeah.
Taking that one today.
I did have one, we have a number of people, including Miss Roberta Cates, who's on our executive board, who's not unfortunately able to be here today. Do you accept handmade new items?
Yes.
For the drive? Okay. So, well, Roberta and I may have to get to work. Actually, Eve is a crocheter too, who's also on our executive board.
And
who's not here,
I
so.
can knit, but the only thing I can knit are scarves.
Well,
So-
get busy now, we'll be
It's
ready.
like
by-
straight.
That's all I can do too.
I can do none of that. I can buy
All
socks
right.
though.
Well, we have a crochet class at South Park, so that's our.
Oh,
Wow.
All right, so we're gonna move on now to do a quick meeting recap of our September meeting. Kate, do you have the?
Well, that would be great if I had any notes, but that Jerry doesn't seem to have notes, but I was here at the meeting, so, so we were intending and we're expecting to have Dr. Cash at our September meeting, but he had to go out of town at the last minute. So we read a letter from him to the BPTO membership. And we discussed quite a few, especially opening school issues. We did have some difficulty because we had folks here without masks and folks who wanted to participate but weren't really able to sort of follow along with us. So there was some disruption at the meeting, but I feel like what we got through, you know, we talked a lot about our summer retreat where we set our goals for this coming year, and got reports from all of the teams. And if anybody remembers anything else. Good.
Okay.
Okay.
So since we don't have the meetings to read through and approve, what I'd like to suggest is that we'll see what Jerry has and approve meetings for both, the minutes for both meetings at our next
So we'll
November
table these
meeting.
until November.
Yes.
But
Okay.
can I just add, I'm sorry,
Yeah.
you're selling yourself short, despite that minor disruption. The meeting was wonderful. You got through your entire agenda. There was a lot of wonderful feedback, as you always have monthly. So, you know, you may not have your robust minutes that you're accustomed to doing, but it was a wonderful meeting. Yeah, it was. And that was just,
Dr.
you know,
Reynolds, that's so
here
nice.
has a different perspective, which is fine.
Yeah.
Yeah.
And you deserve to be thanked too, because you were still handling the issue.
Oh.
When the
Yeah.
rest of us were leaving.
Well, yeah, and I appreciate all of you because I tried to do this remotely, to be here remotely from Ohio, and it was a struggle just for on my end of things as well. So, you know, it like everything during COVID, right? Things are a bit disrupted and a bit unusual, but you know, we do continue to do the work and get it done. So that's great. And then Chris, could we just do a quick treasurer's update now?
Okay, yeah, we talked last month about our backpack giveaway that we did jointly with Jen McCosey. And we ended up with quite a bit of money left over, about $900. So we're gonna hopefully do another one for the second semester. All of our checks have cleared from that and from our town board as well. There's only been a couple of expenditures since then. One was for taxes. One was for a $50 Visa card for the parent engagement through our key grant. And our balances are really good. We currently have $31,631. So we're doing very well.
Great. Thank you so much. And just, I think I've said this before, but we have been working really hard to create a passport to culture program, which we'll talk about during our updates. And so because we started the planning and the the idea generation and reaching out to community partners prior to COVID. But because COVID hit and because everything shut down, we have not been able to like get big numbers of kids to cultural events like we would like to do. And so we continue to raise money and work hard to try to be prepared for when things do open up fully and we can have, you know, nights at the zoo, days at the Science Museum, days at art galleries, any theater productions, all, you know, lecture series, anything like that, music events. So our plan long-term is to apply those funds to that work. But before we jump into our standing committee updates, which includes more about that, we wanted to talk about an attendance contest idea. So Kate, I'll turn it over to you for that.
So we have 3 priorities for this school year. One is to oversee the federal monies. One is to focus on mental and physical health of families and children. And the third is to really focus on attendance and trying to increase attendance. And so we were thinking about having some sort of school-based contest for attendance. But we're really reaching out to our greater membership to think about and ask for ideas about how we might approach a contest. Like, are we going to have prizes? If so, what are the prizes? How is it organized? How can we get all of the principals on board if it is individually school-based? So those are some of the questions that we've talked about. So we have not started the contest yet, but we're hoping for ideas. So if anybody has any ideas about what they'd like to see in such an attendance contest to sort of promote, especially with the older kids, please let us know. Okay, yes.
So
Yes,
I
Julie.
and I don't know if they still do this, but this is actually my first year working with Say Yes. There was a huge attendance contest across the district in partnership, I think, with Taco Bell, where the school with the highest level of attendance got to have a celebrity come to the school and be principal for the day. So it actually was hashtag that one. Fabulous was principal for the day, so a couple of us are saying yes. I know.
Really? That's so cool.
So we were there to support, because we, you know, ramped it up to try to do Say Yes scholarship stuff, but the kids loved it, and you know, a couple of students were in the office with them, and Mr. Samato. So I don't know if Taco Bell still runs that, because things have changed. But I think that would be something good to look at bringing back, because it really would hit that high school population. And I don't know what celebrity, they choose their celebrity. I don't know, but that was who came that year.
And when did they do that? Was that before COVID, obviously?
It was
Yeah,
before
okay.
COVID.
That's cool.
Well, if it was Tino, if Tino was at
Yeah.
Hitchcock, it was, yeah, it was a while ago.
Okay, that's a great idea.
On a much lower scale. At Bennett, what we used to do is, we used to give the kids tickets every time they came in on time to class or to homeroom. And then those tickets were sent down to the attendance office, and she would draw one from those, and they would get a gift certificate or gift card, you know, which is, you know, like, you know, $15, $20, but even that encouraged a lot of kids.
And
to
was
come.
that like every day or once a
It was
week?
every day. And
Okay.
so the kids, they would come in and they'd say, where's my ticket? You know, they wanted to be sure to get that chance in there. So
I think
they were into
a
that.
couple of other high schools too offered an attendance incentive similar to that, to have the senior dues or prom fees paid.
Oh.
And I think that's a really good one, especially right now.
Great ideas, guys. I'm typing away here. So it sounds like maybe, possibly, we might have an attendance contest for K-8 and then maybe a high school version. Because they really do aim, you know, they have different needs.
Or
Fabulous
different
versus,
motivators.
you know,
Yeah. Yeah.
a
Maybe we
gift
could
card.
get gift certificates from like Clayton's Toy Store or something, you know?
Yeah.
Okay, John has his hand raised. John, do you want to unmute and ask your question?
Hello, everyone. Yes, a couple things. I would consider how you can involve student voice in this. So perhaps a simple survey to students about what motivates them to come to school, and that might help with identifying, if you do prizes or rewards, what type of prizes and rewards would motivate them. And the other thing is just to consider the purpose of this. If you're looking for attendance growth, I would consider not only rewarding schools or students who have consistently high attendance, but also maybe some sort of metric where you're looking at rewarding students whose attendance has improved over a certain period of time, so that we're motivating those students who may have difficulty or challenges with attendance, but also who have shown improvement with that challenge over time.
Thank you.
Thank
Those are
you.
great ideas.
And actually, we have sitting at the table here, Devon McCune, who works with youth at the Grant Street Neighborhood Center and through Push. And so, maybe there's opportunity here for us to draw on some of those voices as well. We would love to collaborate and find out, what the kids you're working with think would work.
Definitely any way that we can reach out, we would love to do that. I think it should be a really in-depth and multi-tier approach. I think there should be a district-wide, something where you can bring in a celebrity, but also think it should be a school to school, where you can have the most improved things of that nature, so that they can do those things. I also think that it's an opportunity to enhance and take hold of social media. We have a social media world, so even when it comes from ticket or post yourself with a picture with this hashtag or whatnot, then we can start to create a wave. It also could be something that you can start to shout out at our sports events, games, and even something that you can bring in, waving up throughout the years. I don't know how it went, but it could be, halftime, Burgard playing Bennett, and they're like, East High School has the highest attendance so far, and so they're on track to win. But you give those updates, and then with the hashtags or whatnot, you can even go and grab those pictures and create slideshows or whatnot and have the kids showing themselves going up. But I think with some real creativity and thought, this could be something that you can do year round, that you connect different contests and concerts to, and really turn into something special. And maybe something that we can get the superintendent and assistant superintendents as a whole to really put some money behind, and not just, depending on what you guys fundraise as well.
Awesome. Okay, I'm giving you my card right now.
All right. Card.
Actually, could that federal money be used to improve attendance that way with contests? Would that be?
It's a good question.
Yeah, because if that would be the case, we could give real prizes.
I feel like, and you have to kind of base it on something related to the pandemic, and I feel like you could.
Yeah.
So if possible, yeah, absolutely.
Interesting.
We're supposed to talk about attendance and suspension and data in an educational support committee coming up, hopefully in November. So that would be a good place to.
Thank you.
Yeah, we would love to sort of support and encourage. And also, a big part of what we think is important to do is offer children and youth opportunities, right? And so many opportunities have been curtailed over the course of the last couple of years now, that, if this is a chance to re-engage and get kids, excited and energized about doing things, I love that idea as well, so.
I just had an idea that popped up, and I don't work with younger kids in general, I'm in high school and now, but I think for younger kids, it's more dependent on parents and doing those things. So maybe there could be a parent prize component, or it could be like a spa day or.
Spa day.
Things of that nature, and it also could be a way where if we can get them in on the hashtag and people post their pictures of their kids
Oh, that's
That's a
great.
key point for the
Yeah.
younger
That is a
kids,
good
because
idea.
really, they get there because their parents get them there.
Yes,
Right.
yeah.
Right.
Also, like in the schools, like many of the schools have different clubs and groups. So you go, if you pick a school, target a group, a lot of them, you know, they provide like a code, like if you want to buy this hoodie, you know, some of the kids might not be able to, but then with that.
Yeah, like the swag for.
Yeah.
Yeah.
For their
It's
school,
very,
yeah.
it's very expensive. in
Yeah.
A lot of schools, and maybe the child might want that soccer one and they can't get it, or the Chinese club. Or
Yeah. Cool,
Great
Great.
ideas. Thanks, everybody.
yeah.
Keep them coming.
Great, all right. So we're just gonna quickly do some standing committee updates. Some of our members, like I said, it's a very busy morning today. There's a lot going on. And so several of our executive board members were not able to be here. So we will table some of these. Our education policy committee is chaired by Ms. Denise Barr. And so we'll table an update until the next meeting for that, but I'll turn it over back to Kate for curriculum. committee
Okay.
update.
So I am the curriculum chair, and on October 6th and 7th, Buffalo Parent Teacher Organization and other parent reps were invited to speak on a panel discussion for BPS administrators and educators. It was titled Parent Empowerment for Community Healing, Bridging the Gap to Dismantle Racialized Outcomes. And Dr. Fatima Morel was our host. She's the superintendent of culturally and linguistically responsive initiatives, and she was also the moderator. And parents discussed a variety of issues such as COVID protocols, student and family mental health, systemic racism, building family and school collaborations, how to talk about race and racism with children, and lots of other important issues. So the audience, it was really a great opportunity because the audience members were faculty and staff and administrators, and they were asking the parent panel questions. So I really like that sort of flipped idea where we were the experts on how well we were navigating COVID and schools and everything that's going on in the world. So they asked questions, and then at the end, we got invited to hear Dr. Angel Acosta speak about mindfulness and healing trauma. So it was a really great opportunity, and it was 2 days worth. So in terms of other curriculum issues, I'm still navigating as a new executive board member, a newbie again, how to access heads of departments to talk to them about curriculum. So I've had lots of people ask me about different curriculum issues from elementary school to high school. For instance, one of the outstanding questions that I have deals with the English department, and the fact that, you know, for many, many years, we are very sort of surrounding Shakespeare for 4 years of high school. Every year, the kids have to do Shakespeare. Now, we know that there's lots of relevant, updated literature that better reflects our population than William Shakespeare. So I want to talk to the English department about where we're headed in regards to culturally responsive texts and how well that department is working with Dr. Fatima Morel's department. But I'm having difficulty with response. So that's my overwhelming question that I've been working on all summer. But I have a little clipboard, and I'm thinking that, like, I would like to get a research team together of parents and community members who are interested in learning more about what our children are learning in schools, right? We send them, we hope for the best, but you know, as a literacy specialist, I know that there are best practices in terms of literacy and how we approach book choices and those kinds of things. So I want to know more about the curriculum. So I'm going to pass this around. If anybody has outstanding curriculum questions, we don't have a ton of parents here today, so I'll bring it back in November. And if anybody's interested in meeting to talk more about curriculum issues in our district, you can just put your email down here. Okay, so I'm just going to pass that along. I don't expect to get a ton of response because our group is kind of small today, but I will bring it back in November. So does anybody have any questions?
Have you considered possibly maybe getting some grad student interns from colleges to help with the research part? I'm not sure what participation is from parents and other faculty, but it might be nice to have a grad student who's getting credit, so they're invested in their grade.
That is a great idea. Absolutely, that's a great idea.
I can put email down to facilitate that
Would you?
discussion.
That'd be great. I'd love it. Thanks.
If you want, we could circle this and share this for Saturday academies, you know, when parents check in, and say, if you're interested, put your name, try something.
That would be great.
So I could do that for you with our navigator, PCL teams and have it in the parent center.
That would be great. I'm gonna give you my.
I
like to
throw
whip out
your
my
cards everywhere.
Nobody
Love
really
it.
uses them anymore. It shows how dated I am.
All right, so if that's all. for
Yep, that's it for
committee,
curriculum. Thank you.
Family engagement and events committee, Danielle, can you give an update? I think you.
No,
No.
I haven't been involved in anything on that level yet this school year, so I don't even know where it's headed.
Okay, so I was thinking of the passport to culture.
Oh,
as
you
one
know
of
what I was
the-
thinking, like the end of the year thing. that
Oh,
we work
oh,
on.
oh.
I was like, no, we haven't even started that. What are you talking about? Yeah, passport to culture. So, I'm sorry. I've had coffee, I have no excuse. So we got together, obviously, like Rachel was explaining earlier, we haven't had any traction on passport to culture because we can't really get the kids in big groups to go places, but we're kind of revamping our thoughts around it to kind of fit into the new normal. And one of the things that we're looking to do is partner up with the Say Yes camps and hopefully provide, field trips. Like we'll, reach out to these organizations and say, hey, give us a free day. We'll take these kids on the field trips, kind of tie that culturally in, save a little money, hopefully, get more field trips. So that's part of what we're working towards for Passport to Culture. But we're still thinking it'll be an actual physical book that will bring people in, hopefully free days, maybe free nights, maybe group things, and the kids will fill it up, and then there'll be some sort of reward for taking and getting out and seeing the sites. And it's, everything, like Rachel was explaining, the zoo, the science museum, musical things, art galleries, theater. So that's our goal. And we just started revamping the planning and kind of we may tie like a technology piece in. We're just kind of figuring out how to fit in the new space for the year. So that's where we're at. If anyone has suggestions or wants to get involved when we start working on this as a committee, we completely are open to having any suggestions or ideas. Grow this and make it successful. When we launch it, we want it to be great and then have some place to go to be better, so.
Danielle, I know the idea is to have physical outside door access, but I know you did mention a technology component. Is what we're realizing even with our return in person through community schools, parent centers, and adult ed. We do have parents and families coming, which is great. But one of our particular adult ed classes, we had one in-person participant, but we had 11 people say, can we still do it virtually? Because it's just more accessible. And so are you considering some virtual aspects for it at all?
We are. So again, it's in its infancy, but we need to see what's out there and how people are participating.
Yeah.
And we certainly want to make things available. Like, yes, going and seeing these sites or doing these things virtually is great. We'd like them to be able to go and do things, but the virtual piece is going to be important as well. So that people that aren't comfortable still can partake.
We did some virtual things through the Saturday Academies, of course. There were a lot of free out-of-state zoo tours. So a couple of Saturdays, they got to see the Toronto Zoo, the Atlanta Zoo. We did an amusement park, because we had virtual amusement park rides. Even I think the African American Cultural Center, they also had some virtual options for us. So those could be some alternatives. So even though it's virtual, it's like you're still traveling because it's not local virtual.
Right.
Pieces.
Yeah.
I'll be happy to
Absolutely. That was gonna be my next sentence. Sounds like you're volunteering.
In terms of events too, Chris and I actually, just to report out, we tabled at the zoo on October 7th. They had all the pre-K families come and all of their siblings, and we tabled and we did a raffle and just had a great time watching the kids in all their costumes and talking to families, and it was a nice outing.
It was the highest turnout we've had.
It was
since they
great.
started doing it.
I mean, they were trying to chase people out at the end. It was dark and I think the animals were asleep.
Rhinoceros had her baby.
Yeah, I saw that.
Well, that's actually also probably a membership committee update.
It could
in
be, yeah.
effect,
Yes,
right? That
we
was,
did.
I think, the main
Yeah.
membership committee work of the past month. So we can.
Okay,
Yeah, we
I'll check
talked to
that
a lot
off,
of parents.
Rachel.
We
Yeah.
get, what happened to the list of,
It's in the bucket. We do have a list of new addresses and phone numbers and stuff of people who are interested, and we told them all about the Facebook page, and it was great. We
yeah,
got to
we
talk
talked
to a lot of people.
parents.
Awesome. Yeah, and that's, I guess, just to follow up on the membership piece of it, you know, we are continually doing outreach. We did a lot of outreach with our backpack giveaway, with our virtual town hall, and, you know, trying to get people tapped into the work that we're doing and build up that base of people. So do we have a budget and fundraising committee update, Chris?
No,
Yeah.
we haven't done any, you were actually our fundraiser. The last fundraising we got was, we have a night, 20,000 grant from NICEAD. And,
Yeah.
you know, that's it.
Yeah.
And that's been used for our town hall and, you know, to promote our work.
Okay, and so communications and district update. We continue to participate in parent congress meetings. So again, just very briefly, there are multiple parent groups in the district that focus on different interests of different stakeholders. So we are one of 5 groups, and what we do is meet monthly and address issues that are overarching for all parent groups in the district. And we are continuing to meet virtually for those meetings. With the other representatives from the other 4 members. We also occasionally participate in either interviews or procurement issues for the district, things that are relevant to parents and caregivers in BPS. And we actually have our next parent congress meeting coming up this coming week. So the 28th, I believe, is the date of the meeting. So we'll report back on that. Generally speaking, what has happened in our parent congress meetings so far is that we have officially adopted and are in the process of each group signing off on bylaws for this parent congress governing body. And we, you know, get reports from various district personnel on issues that are most timely and of concern to us. So, you know, things like attendance or transportation, you know, questions come up for district personnel, and that's a space where either the superintendent or his representatives can talk to parent leaders about what is going on. And yeah, so members of that are that parent congress at the moment for BPTO are myself and Roberta Cates, and we have frequently have Kate Hawk and Danielle Grismala, and occasionally Denise Barr participating in those on behalf of the BPTO. But like I said, we'll give a more robust update at the next meeting after the October 28th meeting. And unfortunately, transportation, Keith Jones is our transportation chair for BPTO. Unfortunately, he is awaiting surgery and is not here today. But Larry, could I ask you to do a brief update on
Yeah.
transportation based on the board meeting?
This was a huge topic at our board meeting on Wednesday. There were community members and parents that spoke on this. There was a presentation from the district and from First Student. First Student talked about the challenges in getting more drivers actually on buses, driving buses. We've had over 600 applicants since September, but there's such a stringent process to get permits and get them trained and then actually get them on buses driving our kids. A lot of initially eligible applicants become ineligible because they don't meet certain criteria. One of the big ones that I saw firsthand when I visited First Student is the drug testing. We know that in New York State, laws have changed for many professions, but because this is transportation, it falls under the Department of Transportation, which is federal. So if you test positive for marijuana, you are disqualified. And so I raised the question as to whether that's something that needs to be revisited and something we need to advocate to change. In addition to that, we talked about the idea of National Guard. That was raised last month, and the governor at that time did help in making some changes to increase applicants and make the process quicker, but at that point declined the use of National Guard, and the superintendent felt as if we needed to revisit that with the governor. And then the third thing is that a task force, a transportation task force is being formed. President Petrucci and Vice President Kathy Evans Brown are leading that task force, consisting of district staff and I believe community and parents. Small group that's going to meet regularly, because this is going to be, unfortunately, is going to be an ongoing challenge for us. With winter months coming in, Cheryl Kennedy mentioned that that's a time, it's tough for us to drive our vehicles. And when you're driving a bus with 60 kids, it's even more stressful. So that's a time where they have either drivers leave or they have more difficulty hiring drivers to drive the buses. And then the aid issue that is coming up, we have budgeted aids for all of our buses, but the problem is, just like drivers, we're not getting applicants to serve those positions. We have just actually had interviews, or there was a job fair for aids, and we did increase some aids on our buses, but we're far from the place where we're going to have an aid on every bus. But just want that known that it's budgeted, it's something that the district and the board are committed to, but it's the same challenge of not having enough applicants to get aids on every bus.
I didn't know that there's, one of the problems with getting aides is because it's a part-time position, and there's been some talk about having them become aides in the school, since there's also a shortage there. Is that being looked at realistically?
So this was brought up a few years ago before I was on the board, and it was explored, and it was brought up again in our meeting on Wednesday, and it's going to be brought up again to see if we can do it. There's some nuances to it because it's different unions involved. So that would have to be worked out too.
What about increasing the pay scale? Because I know that like the aides are paid very little.
Yeah, the transportation aides are.
Well, in the schools also, I think they
Well,
only
no,
pay like $15 an hour.
We approved a new contract. I don't know.
Oh, with the 10% increase, yeah.
Yeah, so there is an increase for the aides in the schools. I think that's what it is, you know, if they're getting more money as aides in schools, they would want that rate, and rightfully so, if they're going to be on buses. So I think that needs to be revisited.
But there's a technicality with those two union positions being in conflict.
There's an actual, what's it called? Tab, transportation aides of Buffalo is their union. And then BEST is the union
Best
for
for the
aides and
aides,
teaching
yeah.
assistants in the schools.
thank you for that. We know it's an ongoing issue and a bigger one than.
Oh, one other thing I
Yeah.
forgot. There's also ongoing talk about NFTA being used to transport 7th and 8th graders. The school, yes, the schools that are 5 to 12, parents were surveyed there, and I think they only got 15 responses back saying they would be interested in it. Curious to know from folks that are here, how you feel about if that were to become something.
I'm gonna tell you, so we got, we're at a 5 to 12. And so we got that notification. I was like, why on earth would I want my child on an NFTA bus? Like, I didn't understand the need for it. I was talking to another parent who has a 7th grader. And she's like, yeah, we need them because they need to be able to go through sports and stuff. So I was completely like out of touch with even why it was a thing. And when I look at the buses after school, they're like loaded.
Yeah.
And I look at the buses in the morning, when I'm
NFTA
dropping off
buses?
the NFTA bus, they're loaded. I mean, they have bodies,
Always
like, are we
crowded.
talking dedicated buses? Are we? Because we got one for Evan, it would have been, I think like 22 and 23 were our buses. So I'm like, well, is that just like a dedicated bus for kids or is it like public transportation? Because they're loaded and not so much maybe the North Buffalo buses. But when I take Evan to school and I watch those buses pass me, they are sardines. And I'm like, why would people, like, I was completely out of touch. So Kai, for my child, declined the bus, because I didn't understand the need for it. And I also was like, those buses are really, I mean, they're loaded. I see them with my eyeballs, so I
would say, like, I mean, my kids all rode public transportation. So as 7th and 8th graders, I feel like they're mature enough. But during COVID, if the buses are packed, like, no.
That's what I mean, like,
You
I
know?
mean now, not talking
Right,
like,
right,
you know,
like,
5
I
years
get
ago.
that.
It would have to
Sure.
come with NFTA providing more buses.
Yeah.
Yeah.
They would certainly need, I mean, like a lot more buses.
I think
They
they
are
may have
really
shortages too, though, because like I was at Riverside Wednesday and they have the specials there for the kids to get on. And there was still at least 100 kids that were standing on a bus stop on Niagara Street because they couldn't get on the buses.
Right.
And that's kind of where we left it in our meeting. It would not really be a solution to our problem.
Yeah.
It would create more problems.
I'd be afraid with 7th and 8th graders too, because
The-
there's too many games and stuff.
Tapestry has 7th and 8th graders that use NFTA. So that's why it was thought we should consider it.
I see the point, like, because I did have to talk to another parent, so I was like, why do we need this? And that you gotta step back, it's not always about you, you know, and so she was explaining, I was like, well, it makes a lot of sense, but like, are we getting enough buses to like accommodate more kids coming on, even if it's only 15 kids per school, let's say? Like,
But
do you have
honestly,
space for those kids?
even before COVID, our kids get passed by every morning. You know, like there are kids who wait for 2 or 3 buses if they're
And
riding
now, I mean, we're
NFTA.
not sending as many, but it wasn't a big deal, like when I was a kid, because there was another bus in 9 minutes.
Right.
Now it's like 20.
Right, right.
So, I don't know, I,
Perhaps the possibility might put people at ease if it was like, I know for some high schools, there are school specials, so it's an NFTA bus that's specifically for that school. So I know like possibly some of the concern is that these are younger children, but maybe if it was specifically for that school and there's no one else getting on other than those children, that might make people feel more comfortable with that option.
Yes, I agree completely.
certainly,
NFTA, I think, is gonna say, well, we can't, that's something we can't do. It's public.
they need more
transportation.
buses, yeah. Like, our school always had a special, I didn't know that wasn't like a thing. That
Because even
everybody
the
got.
special buses, I think, are still open to public.
They weren't, the specials were just specifically
Oh,
for
really?
those
They
students.
used, yeah, the specials used to just be,
So then maybe they.
Specials.
could
Just for
do
the
it.
school, so they would stop at those specific stops, like to make sure that each student was getting on or getting off at
Yeah.
their appropriate place, but it wasn't open to the public, it was just specifically for the school.
So maybe it could be.
Yeah, but they must be having shortages too. So there's
Yeah.
a big ad in the Buffalo News for bus drivers for that.
Everybody's
NFTA,
struggling.
yeah.
Thanks, Larry.
All right,
Yeah,
thank you
that's
for that update. We've actually reached the end of our agenda right on time. I just want to offer up the opportunity for anyone to announce any upcoming meetings and events or other announcements that you all might have about things that are happening, things you want us to know about and or advertise on our social media and to our listserv, we'd be happy to do it.
Okay, so, my name is Dave McCune, kids call me Mr. M, and I run the Grant Street Neighborhood Center. We're at Push Buffalo's main office, because the Grant Street Neighborhood Center is under construction, owned by the city since 2018, so they can speed up on that, and that'll be nice. But we have programming going on now. Our normal times are 4 to 6, Monday through Friday. We have chess. We have art, exploring African diaspora. We have capoeira, which is Afro-Brazilian martial art. We have hip hop dance. We have esports, so video games. So when mom said you can't make money with playing sports, look at us now. Not only that, but you can get scholarships. So Harvard, Ohio State, they offer scholarships to play video games. And as just like I played football for UB, you can get on their sports team and get a scholarship. So we really want to, how can we professionalize it and open up to all of the potential jobs that can come from it. So there's a business side to it. If you want to do events, if you want to do marketing, and then on to the harder part where you actually can make money if you want to make video games. You want to be the graphic designer or the programmer and all those things. So we really want to revolutionize and find more ways in which we touch our youth and teach them these real life skills. We have, well, fashion is on hold. Our fashion teacher's on tour with a local Buffalo rapper, Benny the Butcher. We have Taekwondo. Taekwondo started, it's 7 to 8 on Thursday. So it's outside of, it's late after school, but it is free. And parents are welcome to join. As long as you come with a kid, you just can't be in the company. But if you're an adult with a kid and you want to do Taekwondo with your kid, then you're welcome to do so. And
Are these by age group?
I was just gonna say, is there an age limit?
12 to 22, I'm sorry.
12 to 22.
From 12 to 22. So 7th and 8th graders. I am a proponent of getting 7th and 8th graders on the bus. I found that the past couple of years, the resiliency of our kids is low. And so they want parents to give them rides, being a 14-year-old, 15-year-old, sometimes a 16-year-old, which is really wild to me. Because I've grown up taking buses and all of those things. So I'm a proponent of getting them on the buses early and getting them to navigate our city. Our city is small. You can get places very relatively quick. And also I find that responsibility helps and it translates into jobs and things of that nature. But if you have a 16-year-old who needs a parent to take them to a summer program or something that they want to do, then how much more do you have to fight for a job? And so those things translate. So trying to instill that responsibility early is something that I'm a proponent of, barring COVID. Now, COVID stuff is happening. We don't need to put them in danger, but in a pre-COVID world or post-COVID and everybody's vaccinated, then let's try to get as much responsibility as possible. And also with 7th and 8th graders, kind of a weird years before going to high school. And I think giving them a responsibility and pointing in the direction helps a lot. STEAM soccer is coming in November. So STEAM is science, technology, engineering, arts, and mathematics. And so they get a half an hour of a STEAM lesson that's connected to soccer, and then they get an hour and a half of soccer. And basketball as well, which will be taught with life skills and also organizing skills. So how do we as a community come together to champion an issue, and how do we use people power to get issues and policies moved for us? So we're doing those things. COVID has made it very tough. I've been in after school programming for 10 years. And if I get in front of kids inside the schools and I can do that, COVID, I can't come in the building. Even when I meet guidance counselors face to face, after they go back in the building, they forget about us. Like, you can do a virtual tour. I'm willing to do that. 2-3 weeks, no response, come back, hey, I'm here, and those things. So we've had a hard time getting kids to come, and I can't recruit in the same old fashion. And now we're looking at new ways of doing money or coming to meetings like this so that we can spread it. So spreading the word any way we can, it is more than welcome. But I'm creative and I'm a visionary. And I'm already working on taking kids to Ghana and hopefully the Dominican Republic. But I need kids. If I get kids, then I can get money. And so that we can do some amazing things. Yes, sir. So I have flyers and we're open up, 12 to 22. And also we're relaxed with our ages. So if younger people come in, my summer campus last year, we had a 9-year-old and 2 10-years-old. Parents come like, can you please? We work with them if the behavior is good. And then mature them and work with them. So we're flexible and we're for the community and, and we're really looking to do that.
Oh, great, thank you so much. Yeah, it's really exciting, and all of that programming, I mean, you're hitting sort of like the broad range of kids' interests too, right? So appreciate that so much. And again, whatever we can do to kind of help get that word out, we're happy to do it. So we appreciate what you're doing. All right, any other announcements?
So I just would like to share, my name is Brittany McKay again, for those who don't know. Thank you for the meeting today. It's been great. I am the community recruitment specialist at Girl Scouts of Western New York. I am newer in the role there. However, we are right now recruiting girls from grades K to 12, particularly promoting a all-girl learning environment and like really teaching those young ladies life skills and their leadership abilities, and just helping them learn who they are and who they can become in the community. We have several events, like just kind of randomly table at a lot of events, and we do some private information sessions. It's been hard with COVID to be able to get in Buffalo Public Schools, so we're just trying to create some strategies right now to be able to get in and do that. But specifically just trying to get the word out there about Girl Scouts. It's not just about cookies. They're teaching a lot of like great programming for these young ladies, and there are some things that are happening, programming specifically inside of like after school programs or in the schools, but also like individually with the troops. So if you know any community events coming up, I would love to kind of get on that just so I can learn where to fit in with this role.
Could I suggest to both of you that you contact the BTF, Buffalo Teachers Federation, because they would probably be happy to submit your information to all the schools. They do that through their monthly meeting. There's representatives from every school there.
Are you on Facebook?
Personally or with Girl Scouts?
Either one.
I'm both. I am.
There's a group, actually, one of the groups that comes to mind, North Buffalo Parents, and I always see anybody have information on Girl Scouts. So if you can't get in there, if you could send me something and I can post it in there.
Okay, awesome.
Larry Scott, I'll give you my card.
Also, there are, next Saturday, there's a lot of get out the vote stuff going on. And I know because my son is in charge of the one at Gloria J. Park. And they're gonna have a band out in front of the music store on Main Street, and other people are coming to table. So if that's, I think, especially outside of community center, Gavin, that would be a really good place to sort of recruit.
Okay. Yes, I'm primarily working in the urban city of Buffalo, have some territory in South Buffalo and Lackawanna, as well as North Buffalo too. So that's awesome. Thank you.
Wow, well, guess what? It's 11:04. We did it.
Yay, thanks, everybody.
So,
I picked the right meeting to come to.
yeah, you really did. So we'll close out our meeting now. Thank you all again so much for coming, and we'll continue to do this work. We really appreciate all your suggestions too, especially about attendance and other events that are going on. So let's keep it going. Thank you, everyone.
Thank you. And I did take
Thank you
notes.
so much.
I know Jerry took notes. I just don't know where they
Yeah.
are. They're not in the share folder, but he probably has them on his.
Thank you. The number I gave is